Welcome back into Wisconsin Women. It is all fun and games today. Literally, we're at Noble Night Games in Fitchburg, which is the largest retailer of tabletop and board games in the world, which is pretty incredible. We're going to learn later from the owner about some of the new ones that might be new to us anyway, learn how to play them. Right now we're talking about medicine, and if you've got some aches, pains, maybe some fatigue before you jump to pills and surgery, you might want to check out natural medicine. We have the queen of natural medicine here today. Dr. Ashley Woyak is with us. Thanks for being here.
Thank you for having me.
I learn so much from you every time you come, but I want to make sure that our viewers know what patients are really coming to see you for.
Yeah, so a lot of the patients that come to my office, like you said, fatigue is a big one. Can't lose weight, the hair's falling out. Some of them have like IBS or bowel type problems that just aren't getting resolved. Insomnia is a big one. Anxiety, depression. I'm finding almost all of my patients have some sort of that they're dealing with. Brain fog. Those are kind of the main things I'm seeing right now in my office. So
that's a long list, and I bet a lot of people can relate to one or many of them.
So as Jessa mentioned, if someone's experiencing those things, people think to turn to pills or whatever, or maybe go to their doctor. How are you different than some of the other doctors?
Yeah, a lot of patients have been going to their doctor for years. I typically see patients with chronic health conditions that, after years and years, they're not getting better. So they're used to going to their doctor, kind of getting 10, 15 minutes with them, explaining their symptoms and getting a pill, maybe another lab, and that's kind of it, So when they come to see me, I think it's a breath of fresh air because I'm saying, why is this going on? Let's figure out what's causing all of it. So, a really comprehensive intake, figuring out their history, a lot more labs than they're used to, if that makes sense. So, I've had thyroid patients that they've been on Synthroid or levothyroxine for years, and their doctors have only run TSH, where I'm thinking, well, we need to do way more than that to figure out what's really going on. So that's typically my approach, is way more comprehensive. Let's get the full picture so I know exactly what's going on with you, if that makes sense.
I remember in one of our past meetings with you, you actually brought one of your patients, and she had gone how long? 15 years or something?
Yeah, I think it was 13, something like that.
13 years of not knowing what was wrong and what to do about it until she met you.
Yeah.
That's amazing.
And so what would be some common symptoms for low thyroid function? Because I think that is a common issue.
Low thyroid is so common, especially around women. That's why, that's kind of who I see mostly. Obviously men can still have it, but really common with women. Some of the most common causes can be, poor diet. The standard American diet is not the healthiest for us, as we know.
That's why they call it SAD.
I know, exactly right. Stress, whether it be mental, emotional, or just physical, something like that. What's crazy is I'm hoping to have some more patients on the show, because I found, I've talked before about like environmental toxins, about plastics and things like that. I figured out with a couple of my patients it's been a mold issue that's causing their problems.
Wow.
Yes, for one patient it was actually in her home, like where her home office and where she was sleeping was causing all of her symptoms. And another patient works for a public building, and they had mold all in that room, so we figured that out.
She's like a detective.
Yeah, it's crazy.
Thinking of TV shows that are coming to my mind. I've had a reality show here.
Yeah, right. Like the patient before, like it can be a hormone imbalance. A lot of patients don't realize that their birth control or hormone replacement therapy, especially if they're on it like through menopause, that's causing thyroid problems. So they think they're fixing one thing, but then they're causing a problem somewhere else. So those are kind of the main things. So you've just got to figure out. It's a lot, but it just takes, peeling back those layers of the onion and figuring things out.
You say those are the main things, but you just listed so many different types of things where it's like everybody's different, and that's why doctors are having such a hard time.
Yeah.
And then maybe just masking it with a medication or something. So I think it's really important that people understand they could spend years just sort of living with a problem that there is a solution for.
Managing it versus maybe solving
and
it.
you really peel the layers down.
Exactly. And I don't want to blame like medical doctors, because they're so busy. They only have 15 minutes really with a patient. They don't have the time to figure it all out. That's just kind of how it goes. So
right, and that is just sort of the way that the medical industry has gone over the years. And there are so many potential issues. We have so much more to chat with you about, but unfortunately we never have enough time. So I want to make sure our viewers know what to do. If you're somebody at home that might be dealing with an issue as simple as fatigue, how do they get in touch with you?
Yeah, definitely just call my office or go online to our website for a free consult. I'd like to do just a quick 15-minute thing to see if we're a good fit, like what's going on with you and how I approach things, if we seem like a good team together. So
Dr. Ashley Woyak, Forward Natural Medicine, we're Wisconsin Women, and we'll be right back.